Hi, this is Daniel DiTuro. Do you know how the placebo effect can affect your mental and physical health? In this video, I'll share what is a placebo and the placebo effect. Is the placebo effect real or imaginary? The placebo effect and diet, and the nocebo effect. A placebo is a tablet, capsule, liquid, or injection with no known therapeutic effect. Sugar pills are a common placebo. A placebo can also be a sham treatment or surgery. For example, a person believes they received a new treatment or surgery when in fact they did not. The placebo effect is when beneficial results are reported after taking a placebo. Controlled clinical trials use a placebo to test the effectiveness of a prescription drug, dietary supplement, medical treatment, or procedure. In many clinical trials, participants receiving a placebo experience the same or similar health benefits as participants receiving the treatment. How can a sugar pill or sham treatment provide beneficial results? At this time, it's not known how the placebo effect works, but there are several theories. One theory is self-limiting disorders. Conditions like the common cold are self-limiting. You recover with or without placebos or medications. The fact your symptoms end after taking a prescription or non-prescription drug is just a coincidence. For example, some people demand an antibiotic to treat a viral infection. They recover from the infection, but kill their gut bacteria in the process. Another theory is behavioral changes. A placebo may increase a person's motivation to take better care of themselves, like eating a healthier diet, increasing physical activities, or getting more sleep. Dietary supplement weight loss is usually due to reduced calorie diets and increased physical activity, not due to taking the supplement. Another theory is reduced anxiety or depression. Taking a placebo and expecting to feel better may be soothing and reduce the levels of stress chemicals the body produces, such as adrenaline and cortisol. The placebo may trigger the release of endorphins, the body's natural pain relievers. There is also the placebo's characteristics. A person taking a placebo that looks like a real drug is more likely to believe it contains real medicine. Research shows larger size pills suggest a stronger dose than smaller pills, and taking 2 pills appears to be more potent than taking just 1. In general, injections have a more powerful placebo effect than pills. Your state of mind can have a profound effect on your mental and physical health. Most weight loss and feel-good dietary supplements rely on the placebo effect. Why else would dietary supplements have a disclaimer that they do not treat, cure, or prevent disease? Some vitamin and mineral supplements can prevent or cure a nutrient deficiency and its associated medical conditions. In most cases, you must have a nutrient deficiency to obtain any health benefits. Glowing testimonials for weight loss, anti-inflammatory, and other supplements are unverifiable and may be due to the placebo effect. The placebo effect does not mean a person's symptoms or illness is imaginary. Chronic stress can increase blood pressure, and chronic high blood pressure increases the risk for heart disease and stroke. Chronic stress and anxiety are linked to many mental and physical medical conditions. Some people with nonspecific, moderate to severe chronic gastrointestinal pain believe avoiding specific foods is a cure. Unlike people with a known food allergy or intolerance, like lactose intolerance or milk allergy, millions of people without celiac disease are eating a gluten-free diet. Gluten is a protein in wheat, barley, and rye. About 1% of the world's population has celiac disease, an autoimmune disorder triggered by gluten. Most people eating gluten-free diets have neither celiac disease nor wheat allergy. Many believe they have gluten sensitivity. Food sensitivity is not a medical term. It's used by fad diets to justify banning specific foods. In a small clinical trial, most participants who did not have celiac disease but thought they had gluten sensitivity reported no symptoms after eating foods they thought was gluten-free but had gluten. That meant their symptoms were caused by a nutrient other than gluten, or possibly by the nocebo effect. Placebos can produce negative effects called nocebos. Some nocebo effects include nausea, vomiting, joint and muscle pain, diarrhea, fatigue, constipation, and headache. This occurs when clinical trial participants are told about possible side effects before starting treatment. If a person believes a placebo can cause nausea, fatigue, or other side effects, they may experience those side effects. Nocebo is an example of the power of negative thinking. Some takeaways from this video are that the placebo effect is real, but not fully understood. The effect can be positive or negative. Usually, the larger the dose, the larger the effect. And some dietary supplements and diet plans rely on the placebo effect. Please leave a comment if you have any questions about this video. Thank you for watching.